Please start करते हैं genitourinary tract picture. Question number 1. Parent who has no function in their native kidney is found to have declining renal function 1 day after transplantation. A MAC3 enogram shows normal perfusion but diminished excretion, with the following processes affecting the transplanted kidney: acute tubular necrosis. The hint in this is that a MAC3 enogram shows normal perfusion but diminished excretion, meaning that there's normal blood supply to the kidney but there's diminished excretion, so there's a problem in its tubules, so acute tubular necrosis. Post-transplant patient decreased MAC3 neurogram shows acute tubular necrosis, not acute rejection. Question number 2. A CT scan shows rounded renal lesion of diameter 3 cm with average attenuation value of 80 HU with a negative attenuation value on pixel densitometry or diagnosed renal cell carcinoma. Negative attenuation value on pixel densitometry seen renal cell carcinoma.
सर थोड़ा आहिस्ता पड़ा है सर.
Okay. CT scan shows rounded renal lesion of diameter 3 cm with average attenuation value of 80 HU with a negative attenuation value on pixel densitometry. What is the most likely diagnosis? Renal cell carcinoma. Negative on pixel densitometry. Question number 3. Woman has a well-circumcised cystic adnexal mass. Well-circumcised cystic adnexal mass with areas of dense focal calcification, small inherent soft tissue elements, fluid levels, and bright on T1 WMRI. They become dark on fat sequences. Most likely pathology, most likely matured cystic teratoma of the ovary, with dense calcification is equal to teeth. Again, woman has a well-circumscribed cystic adnexal mass with areas of calcification, soft tissue enhancing elements, and fat fluid levels also, and also become dark on fat saturated. Imaging, mature cystic teratoma ovary or dermoid cyst. Question number 4. Ultrasound kidney shows cyst of 2 cm with a thin septum. Cyst of diameter 2 cm with a thin septum. Septum has perceptible enhancement on CT. Most appropriate management, imaging follow-up. Because it is Bosniak classification 2. Ultrasound kidney has cyst of 2 cm diameter with a thin septum. What appropriate management, imaging follow-up. Bosniak 1 simple cyst. Bosniak 2 thin septum and thin walls. Bosniak 3 2F has multiple septum, thin septum, but is surgically resectable. Bosniak 3 have thick walls and thicker septum, and Bosniak 4 thick walls, thicker septum, and calcification also. The Bosniak classification. Question number 5. 78-year-old man with a palpable breast lump, left breast lump. Mammography shows well-defined, high-density lobulated mass in the retroareolar region, or sound shows hyperechroic mass with an eccentric position related to the nipple, most likely diagnosed invasive ductal carcinoma. Most common breast cancer, invasive ductal carcinoma. Most common breast cancer, invasive ductal carcinoma. So, 78-year-old man with palpable breast lump, or sound hyperechroic mass in eccentric position related to the nipple, most likely diagnosed invasive ductal carcinoma. Number 6. The cervix of 25-year-old prima gravida is measured to be 22 mm long. She is most likely to have been treated with which of the following estrogen? Cervix of 25-year-old prima gravida is measured to be 22 mm long. She is most likely to have been treated with which of the following estrogens? Number 7. Testicular ultrasound shows a multilobular mass that is homogeneous and hypoechoic. There is Doppler flow seen in internal hypoechoic band, most likely diagnosed seminoma. Testicular ultrasound shows multilobular mass that is homogeneous and hypoechoic with Doppler flow seen in internal hypoechoic bands, most likely diagnosis seminoma. Testicular ultrasound shows a multilobular mass that is homogeneous, also in areas of hypoechoic density with Doppler flow inside, diagnosis seminoma. Question number 8. Uterine contraceptive device cannot be seen or palpated by the most appropriate initial investigation, pelvic ultrasound scan. After PV examination, if not seen, we can do ultrasound. And after ultrasound, if not seen on ultrasound, then we can do X-ray, abdominal X-ray, pelvic X-ray. 8. Intra-ICD cannot be seen or palpated. What is the next most appropriate initial investigation? Pelvic ultrasound. Question number 9. Renal cell carcinoma in left kidney 5 cm. There is thrombus in the inferior vena cava, left renal vein and right atrium. No lymph nodes and no metastasis. State T3C and 0 M0. T3C shows inferior vena cava invasion. The tumor staging of renal cell carcinoma. Stage 1, tumor within capsule. Stage 2, tumor invasion of perinephric fat but does not uh, involve lymph nodes confined to greater fascia. Stage 3, tumor involvement of renal lymph nodes and or renal vein and renal cava. In stage 3, there is inferior vena cava and renal vein involvement. Stage 4, adjacent organs or distant metastasis. Second stage of renal cell carcinoma. Stage 1, less than 7 centimeter. Stage 2, greater than 7 centimeter. Stage 3, thrombus goes to inferior vena cava and vein. Stage 4 involves bilateral adrenal gland or invasive ground fascia. So thus we have in this range like 5 centimeters, so okay, 5 centimeter. There's thrombus and the inferior vena cava, left renal vein, right atrium. So even though it is 5 centimeter only, but there's thrombus in the left renal vein, inferior vena cava, right atrium, so it's 3TC. Right. Question number 10. First trimester ultrasound scan. What is the most accurate ultrasound measurement for dating the pregnancy in first trimester? Count up length. In first trimester ultrasound scan, what is the most accurate measurement of pregnancy? Count up length. Question 11. History of previous pelvic radiotherapy for cervical cancer. Ultrasound with endometrium is distended by predominantly pure material, and both ovaries have moderately large cysts containing low-level equals. On MRI, cervix returns low T2 signal and ON cysts return high signal on faster plus T1 sequences, most likely diagnosed cervical stenosis and bilateral endometrioma. These shows bilateral endometriomas, bilateral endometriomas, bilateral endometriomas. The history of previous pelvic radiation for cervical cancer or response to endometrium is determined by poor material, and both ovaries have moderately large cysts containing low-level echoes. On MRI, cervix returns low T2 signal and ovaries cyst returns high signal on fat suppressed T1 sequence images, most likely diagnosed cervical stenosis and bilateral endometrioma. Question number 12. Histological examination shows bilateral ovarian tumors and reveals concomitant endometrial angiocarcinoma. Most likely histological diagnosis of ovarian lesions are endometrioid tumor. Okay. Histological examination shows bilateral ovarian tumors and reveals concomitant endometrial adenocarcinoma. Most likely histological diagnosis of ovarian lesions are endometrioid tumor, because they are bilateral ovarian tumors, but there is also endometrial adenocarcinoma, so there will be endometrioid tumors. Serous cyst with calcification plus spot mucinous with mucin. What's important is that concomitant endometrial adenocarcinoma, so bilateral ovarian endometrioid tumor. Question number 13. On CTKUB, the ureter deviated medially and obstructed by a large plague-like parodic soft tissue density. The aorta appears taped down to the vertebral column rather than elevated by the parodic tissue, most likely diagnosis, led by tonal fibrosis. This CTKUB, axial section. The ureters are deviated medially and obstructed by a large plaque-like aortic soft tissue density. The aorta appears taped down to the vertebral column rather than elevated by the parotid tissue, most likely diagnosis, peritoneal fibrosis. On CTKBs, both ureters are deviated medially and obstructed by a large plaque-like aortic soft tissue density lesion. The aorta appears taped down to the vertebral column, diagnosis, peritoneal fibrosis. Question 14. In IV intravenous urogram control film, the green outline on the side of the vein is indistinct and enlarged. The same kidney has a staghorn calculus and shows no evidence of function following contrast injection, most likely diagnosis, genitourinary pyelonephritis. No, this is emphysematosis pyelonephritis, genitourinary pyelonephritis. The calculus. is also called bare paw sign. The intervenous diagram, the renal outline on the right side of the vein is distinct and enlarged. Vein outline is enlarged. Same kidney as a standard calculus, and shows no evidence of function following contrast injection. No function following contrast injection. Outline, minimal urine outline. Diagnosis, xanthochromatosis pyelonephritis. Question 15. CT scan shows primary bladder tumor involves bladder muscle without perivascular extension. Malignant enlarged lymph nodes of 4 cm greater dimension in the ipsilateral anterior neck and 1.5 cm greater dimension in the common iliac lymph node groups are present. Was accurate T and M staging T2 and 2M0. Without perivascular extension T2. So T1 is no perivascular. Okay, T1 then T2, T2, T3. This is the perivascular area. Now T2 is up to the serosa, but up to serosa again. T2 is up to serosa. That is the perivascular area. Up to perivascular area T2 and perivascular invasion then T3. So no perivascular invasion, so T2. Then there are two enlarged lymph nodes, one of 4 cm, 1.5 cm, so N2, and no distal metastasis, so M0. Question number 16. Ultrasound shows both kidneys are in smooth outline but enlarged. Which of the following diagnosis? Sickle cell disease. On ultrasound, both kidneys are smooth outline and enlarged. Most likely diagnosis, sickle cell disease. Smooth outline and enlarged kidneys, sickle cell disease. But if there are bilateral renal masses, then adult polycystic autosomal dominant polycystic kidney disease. Smooth enlarged kidneys, sickle cell disease. If bilateral renal masses, then autosomal dominant polycystic kidney disease. Question number 17. Hepatitis B positive male. Renal arteriograms with multiple bilateral small renal artery branch aneurysm. The following antibody titer is most likely to be positive. P ANCA, perinuclear anti-neutrophil cytoplasmic antibodies. We have seen this before that the multiple bilateral small renal branch aneurysms are seen. There is also seen in polyarthritis nodosa. Now, which of the following antibody titers is most likely to be positive? Perinuclear anti-neutrophil cytoplasmic antibodies. Question number 18. Man has a radical orchidectomy for a non-semitomatous germ cell tumor, most appropriate for up regimen. Serum tumor marker measurement within 3 months. CT of the chest, abdomen, pelvis for 1 year, followed by 6 monthly CT of the chest, abdomen, pelvis for 1 year. Man has orchidectomy for seminoma, germ cell tumor. Most appropriate follow-up regimen. Serum tumor marker measurement within 3 monthly CT of the chest, abdomen, pelvis for 1 year, followed by 6 monthly CT of the chest, abdomen, pelvis for 1 year.